So now we are going to start growth and development. Growth and development is a very important subject in pediatrics and it is a bit difficult, but for postgraduates it should not be so. At least the way I am teaching, it will be very easy for you. This is the mother and child protection card. This is showing a chart which is available for all the babies who are getting their immunization from the government, either state government or central government. They get a booklet. In that booklet, this picture is there showing the growth of the child. That is the weight. There is three lines. That is the green and the yellow and the orange. They are showing the weight for age, birth to 3 years, for girls and for boys. Birth to 3 years. The green, you can see this side the weight is written in kg, and this side also the weight is written in kg, and over here the age is written in the x-axis. X-axis, the age is written. So as the age increases, the weight increases. So the weight for age increases chronologically. Chronologically, the weight for age increases. Simultaneously, the height also increases. What I told you is in the first year, the height increases from 50 centimeter to 75 centimeter. In the second year, it increases to 87.5, and the height increases by 100 centimeter, 200 centimeters by 4 years. After this, it increases by every year 4 to 6 centimeters per year till puberty, when it is almost 8 to 10 centimeters per year by the LH-FSH surge, which occurs in 8.5 years in girls and 9.5 years in boys. The girls keep continuing in height till 15 years and grow fat till 18 years, and the boys keep growing till 18 years in height and then they become fat. And the growth curves I've discussed earlier, I might discuss later in another video. I just wanted to show you this child protection card because this the mothers have. Along with this, they have the developmental card also, how the child develops according to the Trivandrum TDSC card and Denver developmental scale. So how the child develops, they can use a scale to use for development. I will tell you that in another video. The mother can plot the baby's weight and see which line the baby is taking. Growth monitoring. What is growth? Growth is increase in size of the cells. And what is development? Development is maturity of the maturation of the cells by the nerves. That is the difference between growth and development. Now, development in a newborn, it starts from the cranium and it goes slowly to the foot. Craniocaudal direction. Craniocaudal direction, the body tone increases. Body tone. So, now I will be discussing with you anthropometry for initially, because anthropometry is the way we measure the newborn's height, weight, head circumference, etc., etc. First, I will tell you about the increase in supine length which occurs and the head circumference which occurs during the first 2 years of life. This is the time of neuronal plasticity, and the maximum growth of the child occurs in these first 2 years. So the head circumference, say, the head circumference is 35 centimeter approximately at birth. It increases by 12 centimeter in the first year and only 2 centimeter in the second year. So that is 49 centimeter at the end of the second year. By 5 years, it will increase by only 0.5 to 1 centimeter and it will become 52 centimeter at 5 years of age. Similarly, the supine length, supposing it is 50 centimeter at birth, in the first year it will increase by 25 centimeters. That is, it will be 75 centimeter at the end of 1 year. And half of that, that is half of 25, 12.5 centimeter, it will increase in the second year. That is 87.5 centimeters at the end of the second year. By 4 years, the height will be 100 centimeters. Now, after that, the height increases by 4 to 6 centimeters per year, that is annually, till puberty starts. Now, what is puberty? Puberty is a surge of two hormones, that is luteinizing hormone, LH, and follicle stimulating hormone, that is FSH. So luteinizing hormone, LH and FSH, there's a surge of it. In girls, it is 8.5 and in boys, it is 9.5. Before this, if puberty starts, like say 6 years or 7 years in boys, their parents might present with thelarchy, which is the first sign of puberty in girls. You should not intervene. You should assure the mother that little bit of pubic hair may be there, little bit of thelarchy may be there. That is absolutely normal. That is the hormone. You cannot control the hormones. Hormonal surge can occur earlier than 8.5, earlier than 9.5. And those boys will have a testicular enlargement before 9.5, that is, it is 4.4 ml at 8 years. It will be 9 almost 12 ml at 12 years. Similarly, the girl child will increase the size of the breast from thelarchy, that is just a slight raising of the areola and nipple, to a complete female breast by 12 years, 12 to 14 years. Now, it is never limited to 1 year. It may be 2 years later, it may be 2 years earlier. Like menarche. Menarche is another very important milestone in girls. Menarche occurs usually 2 years after thelarchy. Supposing the girl gets thelarchy at 6 or 7 years, it is not necessary that she will get menarche at 9 years. She might have menarche at 11 or 12 years or 13 years at the normal time of menarche. So nobody should feel any, the parents, they should always be reassured that there is no problem at all. It's just a variation of development. So this is the weight for height chart for boys and girls from up to 5 years, 2 to 5 years of age. This shows the 50th centile and the 75th and the 97th centile. Similarly, the third centile. Any growth below this third centile will be a stunting. Any growth anywhere below the third centile will be stunting. And you have to mark it for the age of the child. The age of the child is x-axis and the weight and the height is in the y-axis. So over here also you see the 50th centile, 97th and 3rd. Over here also this is up to 18 years, 5 to 18 years. IAP for boys, IAP for girls. This picture is showing that what I told you, that stage 1, there is no change. Stage 1, I told you there is no change in breast or in abdominal hair or pubertal hair, pubic hair, thelarchy or anything like that. 2, 3, 4 and 5, it is showing the breast development. That is, the nipple and the areola, initially it forms a separate mound other than the breast. Nipple. The nipple and the areola, it forms a separate mound, that is in SMR 3 and 4. But it becomes the complete breast in SMR 5. Similarly, pubic hair spreads to the thighs in SMR 5, I told you. In boys, similarly, penile length, it is less than 3 ml in case of stage 1. And it goes up to 25 ml at finally in the stage 5. And maximum penile growth occurs during the same time. That is, in the first stage 1, there is that less than 3 ml of the testis. And stage 2, 3, 4, 5, it is gradually growing from 3 to 25. Gradually it's growing. Similarly, the penis is becoming longer. There is a sparse growth of the pubic hair at the base of the penis. It is darker, coarser and curlier in case of the boys, and it spreads to the thighs in case of both boys and girls in SMR 5. Due to the breast development in girls, there is stooping of the shoulders. Early adolescence. Stooping of the shoulders when the breast is completely developed. And similarly, there is oily skin in both girls and boys, which leads to acne. Number 3 is sexual attraction towards males leads to unsafe sex. Sexually transmitted diseases, HIV and STI, sexually transmitted infections. Ejaculation often causes fear and guilt in boys, which is not at all necessary. I told you counseling will get rid of it. Emotional identity occurs in both girls and boys, and obesity, smoking, alcohol, these start occurring because what happens is, particularly during the COVID times, they had online classes. They used to sit for long hours and listen to online classes. And when they finished their classes, that finishing the class, including my own granddaughter, they used to take cakes and cold drinks and fast food only. So this fast food, cold drinks, and coke, cakes, and fast food leads to obesity. This sort of food, and nowadays, normally in our days, what we used to do is, after we come from school, we used to go out and play outdoors, and our parents used to tell us, when the street lights are on, you come back. Nowadays, my granddaughter plays till 9:30 p.m. And after that, I'm talking about my own granddaughter. She's just 8 years. 8 years. She hasn't started adolescence. She will start within 1 or 2. She will play more, and they stay in their friend's house for long hours. And when I ring them at night at 10:30, 11, then they are doing their homework. What do you expect from them? When they will get up, and how will they attend school? This is the cause. This is the problem. So this problem should also be addressed. There was a Englishman called Tanner. Tanner first introduced sexual maturity rating, that is called capital S, capital M, capital R, SMR, and that is from 0 to 5. 0 to 5, you calculate both in girls and in boys. That is how you calculate adolescence in boys and girls. Now, Tanner said that you have no change at SMR1, and in boys, the maximum height and the penile growth occurs at SMR2 or 3. The hoarseness of voice, it appears after SMR3, and the emissions, nocturnal emissions which occur, it will occur after SMR3. And then the boy will become, and another thing, very important thing, that is the prefrontal cortex of the brain, it develops in the third decade. So although we know the definition of adolescence is 10 to 19 years by WHO or by IAP or by any organization, the maturity of the brain is complete by the third decade. That is why the irritability, the tendency for smoking, and the tendency for um, other sex, it will occur according to the SMR staging. So initially girls are more friendly with girls, and then they will become more, that sexual attraction towards boys will occur around SMR2 or 3. Similarly, boys, I told you the increase in penile length and height, that is, boys become taller up till 18 years and girls will become tall up to 15 years. Now there's a calculation of how tall your child will be. You tell the parents, you measure both the mother and the father in centimeters, and you divide it by 2, and you add 6.5 centimeter in case of boys and minus 6.5 centimeter in case of girls. So you get the adult height, predicted adult height in case of girls and boys. So this is a very simple calculation. Everybody can do it, it can be done. Now, I will come to the Tanner staging proper. Tanner staging proper, I told you there is no change in SMR1. SMR2 and 3 maximum height, both in girls and in boys. And in boys, I told you, I won't repeat it. And in SMR5, the secondary sexual characters, that is the axillary hair, the mustache, the beard, all that appear in case of boys. SMR5, that is at the final stage, that the boy is becoming a man. The boy and the girl is not only becoming a man or a woman physically, they are also growing mentally. That is from a boy to a man, and that is a huge change. Huge change. That cognitive component is very, very important. That's why I mentioned the maturity of the prefrontal cortex, and I told you that it occurs in the complete by third decade. That is after 30. So the suicidal attempts that occur in adolescence, the restlessness, and the attraction towards the opposite sex, the attraction towards alcohol, attraction towards smoking, all that occurs during the SMR 1, 2 to 5. All this. Initially, in the SMR 1 and 2, the early adolescence, the boys will only learn that smoking causes yellow teeth, it causes bad breath. But the more you go in the SMR 4 and 5, the boys know that it is causing cancer. It makes you more prone to tuberculosis. This is the change in thinking, cognitive change. Early adolescent will not understand. He will understand, he will have the ego that I'm growing up. I'm a separate man than my father. I will go out, I will listen to my peers. My peers will tell me what to do. Peers tell me to ride a bicycle, I will ride a bicycle without a helmet. He tells me to ride a motorcycle, I will go without a helmet. These things occur in early adolescence, but the mid adolescent and the late adolescent, they understand that you need to wear the helmet because head injury can cause permanent brain damage. That comes by the late adolescence, that is by 17, 18, 19, they understand that they need to wear a helmet, they need to wear gloves to protect themselves during riding a bicycle or a motorcycle. Now next is pubic hair. Pubic hair becomes curly by SMR5 and it spreads to the thighs. Pubic hair, it becomes curly in both girls and boys and it spreads to the thighs. Spreading to the thighs is in SMR5. And this cognitive and developmental changes I will stress on more. Now, so what is it? It is the emerging capacity to act more sophisticated. Adolescent thinks that I will become more sophisticated than my father. My father is backdated. You are backdated. My mother is backdated. But my peers are sophisticated. I want to become sophisticated. So I will smoke. I will light a cigarette as soon as I come out of school. Now you can see ladies in Sector 5, you can see them smoking as soon as they come out from their office. They have learned to smoke, but they don't know the risk of cancer. That is, their prefrontal cortex is not yet mature. That is why they are smoking as soon as they come out of office. Their prefrontal cortex is not yet mature. Similarly, many of our friends, school friends, have lost their children in medical schools, third year, fourth year by suicide. Can you imagine a lady hearing in United States, her daughter in medical school at 2 or 3 p.m. her friends go to call them, because for medical students night it matter. 7 p.m. is similar to 2 to 3 p.m. AM rather, 2 a.m. or 3 a.m. 2 a.m. or 3 a.m. they go to their room to call her and they see the light is burning, the room is locked from inside and the girl is dead. So the girl had a steady boyfriend. That girl had a steady boyfriend. That boyfriend was also surprised that why did the girl die. So you cannot understand. Adolescents are very, very difficult to predict what they will do, what they are thinking, because they don't have friends to talk to. Nowadays, nuclear families, they don't have their grandmothers. Nuclear families, they don't have their uncles or aunts. So they don't know whom to talk to, whom to give out their stress and tension to. Because this bodily change, for the boys, the hands and feet become larger before the body and they become more gawky. Gawky, Gawky. The gawky means odd. It looks odd. And that child is very conscious that I am gawky looking. So he thinks I'm bad looking. He's not bad looking. That's a form of development. Some 13-year boy may have gynecomastia. That is, his breast has developed. It is normal in 13 years. It will go away when he's 15, 16, 17. But that has to be taught to him by someone elder to him. There is no one who talks to them. Their parents won't talk to them. Most of their mothers are working. They are not at home. Fathers, they are almost always engrossed in the newspaper or journals or whatever it is. They don't give time to their children. So they have no one to talk to at home. Obviously, they are more dependent on their peers. And their peers, there are different type of peers. There are good peers, there are bad peers. The good peers will give you good advice. Bad peers will give you bad advice. Take some drugs, it's very good. You smoke the drugs, you go to the hookah bars. In Park Street, there are lots of hookah bars where St. Xavier's boys, they bunk school and they go to the hookah bars. Plenty of them. Police don't go and pick them up. No police goes and picks them up. They just bunk their classes, they go to the hookah bars and they are smoking very happily and seeing blue lights and red lights and marijuana, hashish, everything they are taking. So these are the disadvantages of adolescents. They have no one to talk to, they have no one to open up, and obviously their peers are there. Peers give them the pressure, and this is what happens. And their prefrontal cortex is not mature till the third decade. I told you these graduates who are coming out from the Sector 5, they are smoking. That is because of their prefrontal cortex. This is page 98 of Piyush Gupta for undergraduates. This shows the changes of stage 1 to stage 5. You can see there is no change over here. Over here, you can see that the breast bud appears, enlargement of the areola. And over here, it is darker or coarser hair in the pubic region, adult type of coarser hair in the mons and labia, and it spreads to the thighs in case of stage 5. Similarly, the breast has a separate mound in this stage, stage 4. Secondary mound is formed by the areola and the papilla above the level of the breast, and that becomes a complete breast by stage 5. Now over here you can see the testicular size is less than 3 ml in stage 1. It is 25 ml in stage 5. And this maximum penile length and height occurs in height of the baby, and the penile length occurs in stage 2, 3 and 4. The penile length is occurring. You know this penile length, you measured it from the symphysis pubis to the tip of the outstretched penis, and that increases. And the hair, similarly, the scrotal pigmentation also increases. Scrotal pigmentation is maximum in this stage. And you can see over here, it spreads to the pubic hair spreads to the medial thigh, adult genitalia. And this increase in the penile length, it increases from SMR2 to SMR5. But in stage 4, it is not on the thighs. In stage 5, it is on the thighs. This reference is showing the stage between the early adolescence, that is 10 to 13 years, to middle adolescence, 14 to 17 years, and late adolescence, 17 years upwards. This shows the development, that is the rapidly occurring changes of the body, and the guilt and the anxiety that the early adolescent suffers from. And the family, the desire for autonomy begins, finds flaws in the home rules, and increased tension with parents. The middle adolescence and the late adolescence becomes friendly with the parents. This may lead to conflict between the parents and adolescents. They reconcile their relationship with parents, and conflicts with the parents are less. They have more faith in moral, religious, and sexual values of family and community. Peers of the same sex in the early adolescence, friendship with both sexes in middle adolescence, and relationship becomes less exploitive. Committed relationship with opposite sex partner can begin at this level. But remember that the prefrontal cortex has not developed, and so the restlessness of the baby will continue, and the suicidal tendencies and the restless and the fidgetiness, the tendency to have smoking, drugs, and marijuana and hashish will persist throughout. So you have to be very careful. And if the baby does have both working parents, baby should have someone to open up to. If not a grandparent at home, it can be a teacher in the tuition or whatever it is. Any place, any adult can guide the adolescent in this stage. Guidance is required. Health implication, there's undue anxiety. Undue anxiety, I told you, their hands and feet become larger. So this is a undue anxiety and tension. Undue. It is not necessary at all. This has to be, if it is required, the parents cannot give time. They can go to psychologists. They are sitting there. All over Calcutta, all over West Bengal, psychologists are there. They are in general stream. They can read psychology and they can nicely explain to them what their stresses and strains are. That no one can stop them. That is always available, but they don't use it. Parents don't use it. If you go to the psychologist, they think that the people in the vicinity, they will tell you that he's mad. It is not madness to go to a psychologist or a psychiatrist. That is required in adolescence. Or counseling. Adolescent counseling is a very important thing which many pediatricians also can give. Pediatricians also can give. I remember I learned guitar from a sir. He used to come to my house residence and teach me guitar. One day he told me, I will bring you a adolescence, will you counsel her? I said, sure, you bring, no problem. That girl came, she was sitting here while I learned guitar. After that guitar lesson, I asked her, what is your problem? What she said, she said, my father is an alcoholic. My father comes home and beats up my mother and me. So I've left my home and I've come to this sir's house. This sir's house, there's a Bhutanese woman there, young lady. She also has come from Bhutan. She does the cooking and everything to help the mother of the guitar sir. Guitar sir is unmarried. So she is there under refuge of guitar sir, that lady and mother. What a beautiful family. And they are helping her to go to school. They are sponsoring her whole education at teenage. So what else does she need now? She doesn't need anything. So I said, you need not cry for your father. Every father, every mother is not so ideal. Every father and every mother is not so ideal. You find your teacher, you find your father in your teachers, in your persons like this guitar sir who is there. Persons of your school, persons of your college, they will act as your teacher. You can discuss with them everything. You can discuss with them. They will tell you, and they will tell you everything, the questions in your mind. And all the adolescents should have the facility of counseling. Counseling is a big help in this, particularly mental health. They need it very much. Mental health is very disturbed at this time. This suicidal tendencies, this alcoholic parents, this all thing, everything needs counseling. So counseling is the last help for adolescents. I think all the PGs who are listening to this video, they will make it very, very, very obvious to the teenagers that they deal with when they grow up, and they are fully qualified to become a pediatrician. They will be explain it to their patients and their parents.